Hi, I'm Dr. Cindy Collins. I am a registered dietitian and a health psychologist working in oncology. One of the newest areas of interest for cancer patients is exercise. The basic question is, how is exercise involved in cancer survivorship? Well, in many ways, we're finding this out now, and there's a lot of ongoing research which is increasing our knowledge about exercise and cancer. First of all, even previous to your diagnosis, if you were an exerciser in any way, if you were someone who was fit, who stayed in shape, who kept some sort of exercise regimen in their life, you're actually going to find that it benefits you quite a bit after the cancer diagnosis. It turns out that having that healthy constitution, having a lifestyle where you already had a habit of exercising is going to do you really well. Most patients undergoing cancer treatment do better and withstand a lot of the side effects of both radiation and chemotherapy much more easily if they already had a healthy constitution from exercising. So know that being an exercise brings you into the cancer diagnosis already at an advantage in a way. Exercise is also really important during treatment. Now, the amount of exercise you do during treatment could be very different from one patient to the other. Some patients are able to keep up with walking or other exercise, perhaps not at the strenuous level that they were used to, but maybe just downplaying it a little bit while they're on treatment or during treatment. Also, after surgery, there might be certain kinds of exercise that you would need to limit. For example, someone that has breast cancer surgery may not be able to do exercise that involves rotating their arms or a lot of movement of the shoulders or the torso. Something like swimming wouldn't be allowed for a while. Something like golfing might be an issue, and certainly lifting weights could be a problem. Each type of diagnosis has a prescription for it on the allowable exercise and the exercise that would not be allowed. And the best thing to do is address that directly with first your surgeon and then also with your medical oncologist and your radiation oncologist. The other point about exercising during treatment is that you need to be very careful to watch your level of fatigue. On the one hand, it turns out that exercise relieves some fatigue. That would be in someone who's having a lot of stiffness or who's feeling kind of sluggish because they're doing a lot of extra sleeping or extra napping or just not getting around like they used to. A little bit of exercise actually benefits them. On the other hand, if you are going through treatment and you find that the treatment itself is causing you to feel overly fatigued, then you wouldn't want to use all your energy in exercising. So you'd want to be very careful not to exercise to the point of exhaustion, not even to exercise to the point of burning a lot of calories or breaking a sweat necessarily, but again, monitoring or moderating your exercise to a different level. Speaking of calories, some exercise burns a lot of calories. If you are undergoing cancer treatment, where either you have lost weight or you have a risk of losing weight, you would need to be very careful not to use up your calories in your exercise. So that brings us to the third phase, which is post-treatment. Post-treatment exercise is turning out to be very important and a very strong factor for cancer patients staying in remission. Post-treatment exercise can relieve a lot of the leftover fatigue from cancer treatment. It can also give you better circulation and maybe even reduce some inflammatory markers, which we think might be associated with keeping you cancer-free. And it's worth explaining that exercise in all of these cases doesn't necessarily mean aerobic exercise or running or anything that is very active. It could mean that you're just doing movement. I even prefer to use the word movement when I talk about exercise with cancer patients. Exercise might be Qigong, it might be Tai Chi, it might be slow dancing, it could be swimming, walking, it could just be stretching on certain days. That still would be considered a form of movement or a form of exercise that would help with your circulation. The other big benefit for exercise is that it lifts mood. So at any point during the treatment or after treatment where you find that you are not able to really overcome sort of a down way of feeling or a sluggish way of feeling, it feels a lot better and can even in some cases relieve some pain, but also lift your mood to do some movement, to engage in moving and exercise. Circulation itself can make you feel better. And in the end, patients say they feel a lot better about themselves because they've done something for themselves. They've done something that makes them feel more fit and is putting them back on the road to recovery, back where they will get into their usual lifestyle of exercise. Don't forget that exercise should also be fun. You need to choose some kind of movement that you actually enjoy, some type of movement that you can do with others, that lifts your mood, that makes you smile at the end, something you enjoy doing and would actually look forward to doing. So when it comes to exercise, number one, check out with your doctor what is allowable. Check out which things might need to be monitored or moderated. And after that, find some type of movement that works for you. Stick with your exercise for a very good outcome during treatment and also for getting into remission for cancer.